I'm Sunil Rao. I'm Director of Interventional Cardiology for the NYU Langone Health System and Director of the Cardiac Cath Lab here at Tisch Hospital. I'm an interventional cardiologist, which means that I perform procedures that are minimally invasive, largely to treat patients who have coronary artery disease, which is a disease of high cholesterol where cholesterol blockages build up in the blood supply to the heart muscle. That can cause patients to have a variety of symptoms, from chest pain when they're exerting themselves, to having a heart attack, to even having an acute life-threatening heart attack where we really need to go in and open the blockage to rescue the heart muscle and save the patient's life. The cath lab is an area that we can treat all kinds of different heart diseases. So we can open blockages, we can fix leaky heart valves, we can close holes in the heart, we can create holes in the heart if we need to. All of that is done through minimally invasive techniques, so patients don't need to undergo surgery. And the field is really headed towards a more minimally invasive approach so that patients can recover faster and get back to the things that they love to do. One of the most common procedures that we do is stent placement. So a stent is a wire mesh tube that we insert through the blood vessels in a minimally invasive approach. Most of the time, that used to be done via the large artery in the leg or using the artery in the groin. We've developed a more minimally invasive technique where we can use the artery in the wrist. That allows patients to recover much faster. They can often go home the same day, and the risk of bleeding complications is cut by 70%. So the vast majority of our procedures now are done via the radial artery in the wrist, and patients really seem to enjoy being able to get back to the activities that they want to do after getting a stent from that approach. So if the patient is very anxious about their procedure, and it's natural to be anxious about a cardiovascular procedure, what we do is really reassure patients that they're going to get the best care possible, the safest care possible, and their recovery process is really going to be facilitated by the care that we provide. I think what makes a great day for any physician is when you get direct feedback that you've helped someone. And one of the reasons that I was attracted to cardiology is that some of the patients that we see are really sick. I mean, they're having life-threatening cardiology problems or cardiovascular problems. And we have treatments now where we can help them. And so, to be able to see a patient who's having a life-threatening problem, implement a strategy that can save their life, stop their heart attack, and watch them recover really quickly. I mean, that's one of the most gratifying things about my job. I think that's why I went into medicine, is so I can help patients get better and, live a longer and higher quality life.